Okay, so one of the things that people are afraid of when you work with folks in your office is it malignant? Shall I send it to an oncologist? So I send it to a Mohs surgeon. And basically, when you look at folks that are coming in with these types of lesions, you look at them, listen to their history. Do the lesions bleed? Do they have a fried egg appearance? What are the size of the lesions? Are they greater than 5 millimeters in diameter? Are they flat or elevated? These are some pictures of lesions on the left, to your left and right, are normal, and those on the right are abnormal in their shape. You can use a dermoscope looking through the skin to see the edges, to see if the pigment is leaking out on the edge, and that's real important. Asymmetry. One half of the lesion is a different size than the other half. That's a very high index of suspicion when you see something like that, or if the color is mottled. Elevation is usually always present. I was at a seminar in Arizona, and this guy came up, and we were at this working in this booth where we were talking about cryotherapy, and the fellow said, can you freeze this thing off my chest? So he has a shirt and tie on like that, and he pulls his shirt up, and there's this bleeding squamous cell carcinoma about the size of a silver dollar on his chest. I says, you need to see a Mohs surgeon ASAP. So, those types of things we don't want to do in our office, but these are some of the common epidermal lesions that we can be treated with cryotherapy. Warts, porokeratosis, which are plugged sweat glands, seborrheic keratosis, skin tags, molluscum, actinic, solar lentigo. Solar lentigos, or liver spots, are the things you'll see on elderly people who have had sun exposure. They're brown on the back of the hands. The cryoprobe utilizing nitrous oxide can take them off in about 2 to 3 seconds. It turns it dark brown, and it peels off in about, I would say 5 to 7 days. I'll show you some pre and post. You can do small basal cells that haven't had any bleeding or changes of size, flatworts, condyloma, sebaceous hyperplasia, and seborrheic keratosis. That's me loading up a cryoprobe. This young lady came in. This is not an age-related lesion, but I just thought I'd show it to you. She'd been in to see a dermatologist, several dermatologists. First of all, they thought it was a wart. They treated it with liquid nitrogen. It didn't get better. She went to another dermatologist. He treated it with acid. It didn't get better. Went to another dermatologist. Said it was skin cancer and had to put her on 5,4-Uracil. We treated it with the cryoprobe. She went back to Chicago, and then she sent me a video, or I should say a cell phone picture of it. About 3 weeks later, you see it fallen off, and it was starting to resolve. I'm not going to go through the treatment of plantar warts. The cryoprobe is an excellent device. You can use it for children. You can use it for mosaic warts, contact warts between the toes, between the fingers. There's an example of mosaic wart. There's a solar lentigo on the face, and you have the same thing up here on the hands. These are age-related skin lesions. They're benign, and they can be taken off very easily with the cryoprobe. There's a lady that's having several taken off right now. This is another set of lesions you'll see in individuals that have oily skin, and it's called sebaceous hyperplasia. If you look at them under a magnifier, they look like little volcanoes, and if you squeeze them, there'll be a drop of clear, almost like olive oil sebum come up, and as that comes down the edges of the crater on their face, it causes redness. And we had several of these we were taking off of this gentleman here with the cryoprobe and the Elman Surgitron. These were marks on his, that were marked to do. He had probably 150 on each side of his cheek going up into his temple area. This lady here, a very, very pretty lady, had the sebaceous hyperplasia on just a line on her left cheek. And you can see them there. I don't know if I have a pointer or not, but yeah, this is a pointer. And she basically had a ribbon of them that went down along here. That was the only place located on her face. She went up to Oregon Health Science University, saw plastic surgeons, and what they wanted to do was to ellipse the side of her face out and close it up, which would leave a pretty ugly scar. So we decided to use a combination of cryotherapy with the cryoprobe and the Elman Surgitron, going into each of these lesions under 4-diopter magnification to kill the little sebaceous sacs. And this is what she looked at like after the first treatment at about 3 weeks. You see the difference. And she was smiling. She was very happy. We went in and treated some more of these lesions. And then the key to this is being anti-aging docs and doing things to help make people look better and feel better is to make them happier by not causing more scar on their faces, especially if you're working on the face. This is an example of a sebaceous hyperplasia and seborrheic keratosis being frozen off. We did a combination. The lesion under the right eye there was taken off with the Element Surgitron. We're using the cryoprobe to freeze that lesion there. Benign skin lesions on the nose are very difficult to get rid of without scarring unless you use the right instrumentation and technique. This is a cryoprobe treatment of a woman that she's about 55, had bilateral on her hands. Those are the age spots, or what they call solar lentigos. With the cryoprobe pre-treatment, right hand, left hand, you can see several of them. They made her feel ugly. They made her feel old. They just and she said, "What can you do to take them off?" And I said, "We can freeze them off. It takes about 2 seconds per lesion, and there's no downtime. There's very little, if any, pain. No anesthesia is required." This is what it looked like in 10 days.